Everybody. Nice to be here and glad that I made it. Traffic today was kind of awful in Greece without any apparent reason. It's a Saturday, shouldn't be, but thankfully I made it also in time to see some of the wonderful presentations before. So I will give you a small or short presentation of what we are doing in Greece, what is our concept here with the medical holodeck. I'm going to share my screen and okay, so I hope that you see my full screen with the presentation. I am Alexis Theodorou. I am academic fellow and lead of the XR lab in Athens in the Hippocratio University Hospital in the first department of surgery. And a little bit of the background, I first came into contact with Medicalholodeck when I was in Bonn with Jan, and it's a very big pleasure to see him today, even from afar. So this is our small hospital, or our not so small hospital in the city of Athens, near the center. And we have set up a medical XR lab. I'm not going to talk about the advantages already have been presented before. I'm going to spare the time for us, but we wanted to use medical holodeck as soon as I came to Greece 3 years ago. But the main forward step was the introduction of the MetaQuest 3 that allowed independent rendering within the device. So it make the barrier and the threshold for us to go there much easier, not only for us, but also for our partners. I'm going to talk about in the next slides. So the thing that was very interesting for us, for medical holodeck, beside all of the other advantages and benefits that were discussed before, is that you can share imaging data spontaneously so that two people from remote locations can watch them at the same time and discuss at the same time together. So they can collaborate on the same virtual space on a set of imaging that was originated from one space. And that kind of help us remove existing geographical barriers that exist in Greece. I hope that you all know Greece. Greece is a very beautiful country with many islands and remote places that are nice to visit, but represent a lot of difficulties in terms of healthcare access. 50% of the population lives in Athens, but we still have 200 inhabited islands where 1.8 million people live, and 53 of them have over 1,000 inhabitants, but only 20 have full service hospitals, and even they are not that specialized. So we see there are a lot of people living in remote places that don't have access to um, uh, high quality healthcare. And like Instagram versus reality, this is Mykonos, one of the most famous islands in Greece. And this is the hospital in Mykonos. It's basically one general doctor working there and some residents before the medical students that have just finished school and before the residency. Um, and this is the reality of how imaging data is shared normally through Greece when you need a consultation. There is no single universal PACS that you can use for teleradiology, as there is in the meantime in Northern Europe, where people in different hospitals can look at the same imaging together. You are sharing images here through CDs, sending them email, or the most common, you film with your phone scrolling down the CT and sending them through Viber. These are messages that I have received to consult on people on other hospitals. And as you can see, it's impossible to provide remotely advice without good imaging. So what we set up to do is to use that technology that Medicalholodeck provides for three protocols: education and clinical. I won't go far into that because we have already spoken to that in the conference, but mostly to virtual multidisciplinary boards for elective cases and remote consulting for emergencies in medical centers. So we have set up collaboration with a university hospital in Alexandroupoli. That's the one on the north that you see. Distance to Athens is around 9 hours drive. And we have set up a collaboration with the island of Kos, where it's a 50 minutes flight, but around 25 hours boat ride. So the idea was to kind of do a case study of first virtual oncological boards and shared anatomy lectures, of course, and also to see how can we provide emergency consultations to the island, and see if that is something that is viable. Around the virtual multidisciplinary board, we've started with oncologic boards that are shared between our department. It's a specialized oncologic department with the Department of Surgery in the University of Alexandroupoli, where we do it combined through Zoom and Medicalholodeck. We're using Medicalholodeck for all of us to see the CT images and discuss the rest through Zoom. And that is working okay, but there's still a lot of issues between the collaborations between Zoom and switching back to the holodeck that are, of course, a bit cumbersome, but hopefully will we be able to do it completely in Medicalholodeck at a certain point, so we don't have this small delays. And discussing about what I think is the most important part, the giving remote villages, remote hospitals, and remote centers access to expertise is the case study we are doing with the island of Kos. As it Kos is a very big island, but has a very small and understaffed hospital. They have one radiologist that is only days there. It's not on the nights, not on emergencies, and they often have problems getting adequate findings. And we have set up were there. We trained the staff there how to use the technology, because it allows, as I said, at this point where they have the CT scan, to upload it to the cloud, and we can log in there and share and see the CT at that point and give them advice whether this is something that can be handled on the spot, or it's something that should be transferred either to a bigger island or to Athens. Transferring between the islands or to Athens is not an easy decision and should only be taken when it's really necessary. And this kind of help us decide, is this the case or not? If this case study is successful, we are planning to discuss with the Ministry of Health to kind of implement this as a practice in other hospitals around the Greek islands as well. We'll see. And obviously, the virtual anatomy classroom we have with our students that we are making anatomy lessons collaborative between Athens and Alexandroupoli together. So that's that as well. As we said, there is a potential for expansion, and the low cost that is now required to go into that without the need of building expensive servers is very important for Greece. Greece is a country that is now going out of decade-long depression. Funding for innovation is not an easy thing to do, and we were happy that we eventually found a sponsor for our projects, but other hospitals want to go in as well, and the fact that it's going lower and lower is a very important thing for all of us. And I'm very, very thankful also for the support from Christoph, Dominic, and the Medical Holodeck team. Yeah, that's it for me. Thank you.